organization and logic, 15% for delivery and clarity, and finally 10% for time management. So that is the modalities for these events, and I'm sure every participant and the supervising teachers are well aware of this. So without further ado, we'll be going right into the debate competition. So are we ready? Participants, are you ready? If you're ready, just maybe an emoji or you can speak. Okay, I can see you're nodding your heads. Okay, exciting. So we'll be starting with the first team, which is the supporting team, Team A. And for Team A, we have 3 participants. We have Anna Magjo, we have Deborah Jolayemi, and we have Absat Mohamed Bedu. So we're going accordingly as it is written in the modalities. So the first person to speak will be Anna Magjo. Anna Magjo, are you ready?
Yes, I am.
Okay, beautiful. So you have 7 minutes to present, and when I say start, you are to present. Please do not forget all the etiquettes that we discussed about in the modalities. So I'm going to set the stopwatch now to time you. Okay, give me a minute. Okay. So are you ready, Anna?
Yes, I am.
Okay, start.
Mr. Chairman, panel of judges, accurate timekeepers, my co-debaters, distinguished ladies and gentlemen, good day. My name is Magjo and I'm here to propose the motion which states that human papillomavirus vaccination for adolescents a necessity or a choice with the following points of mind. Cervical cancer remains one of the leading causes of cancer-related death among women in Nigeria, with over 12,000 new cases diagnosed every year. The human papillomavirus vaccine has been introduced to help reduce this burden, and this is a commendable step. However, the question before this Honorable House today is not about the importance of this vaccine, but if vaccinating adolescents should be a necessity or a choice. I stand firm to support the proposition that it should be a choice, guided by education, consent, and trust, not compulsion. I'll be defining the human papillomavirus vaccine. This is simply defined as a medical injection given against the human papilloma disease infection. While we talk about adolescents, these are individuals between the ages of 9 and 19 years. We look at choice. Choice can be defined as a voluntary, informed decision taken by parents or guardians. Firstly, parental consent is a fundamental right. In Nigeria, parents are literally and morally responsible for their children's well-being. Medical intervention, especially those with long-term effects, must respect parental consent. Even though the human papillomavirus vaccine has been introduced and be added to the national routine immunization schedule, availability does not mean enforceability. Healthcare works best when parents agree and understand, not when they are being forced. Judges remember this. An informed citizen is a protected citizen. Secondly, education builds trust. Compulsion creates resistance. Nigeria is a country in history has told us about forced medical interventions, which often lead to fear, misinformation, and resistance. Nigeria has previously experienced vaccine hesitancy due to mistrust. However, the human papillomavirus has been introduced to help reduce this tax. Thirdly, I'll be looking at cultural and religious sensitivity must be respected. Nigeria is a diverse nation with strong cultural and religious sensitivities. We have different countries and cultural sensitivities in Nigeria. However, protection achieved through force is not better than protection achieved through cooperation. In conclusion, the human papillomavirus vaccine has been introduced to help reduce this burden, and this is a commendable step. However, protection achieved through cooperation is better, strong, and long-lasting than protection achieved through force. By empowering parents with accurate information and respectful engagement, they are more like they protect the citizen, but if they are being forced, they resist. Judges take this home. Making a vaccine mandatory does not automatically make people safer. Making them informed does. Just because something is effective does not mean it should be forced. Thank you for your audience.
Okay, so you didn't exceed your time. You still had over 2 minutes left, but that's fine. Well done. That was a great presentation, and we would truly enjoy that. And I'm sure judges are taking note of that. Let us take a minute to like clap our hands, our virtual hands. Let's clap our virtual hands to support Anna and to recommend and commend her for the great speech presented. So let's use our virtual hands. We have thank you so much. Oh God, beautiful virtual hands. All right. Thank you so much for that, Anna. That was amazing. So we've heard Anna speak, and Anna was on Team A, the supporting side. So we're going to move to participant two, the second participant for supporting side, and that's no other person than Deborah July Mutupe. Are you here? Are you ready? Okay, Deborah. Okay, Deborah. Okay, I can see you. All right. So Deborah, can you hear me?
Yes, ma'am.
All right, so you also will be having 7 minutes to speak. And once I say start, I'm going to restart the stopwatch now. So once I say start, you are free to go. So
Okay, ma'am.
good luck. Start.
Good day, Chairman, panel of judges, timekeeper, co-debaters, ladies and gentlemen. My name is Jolaimi Deborah Modupe. I stand to oppose the motion that says HPV vaccine for adolescents should be a necessity. I strongly believe that HPV vaccination should remain a choice while protecting other young ones from cervical cancer. We should respect their rights, parents' decision, and beliefs of our society. What is HPV? HPV, also known as human papilloma virus, is a virus that causes cancer, also like cervical cancer. What is vaccine? Vaccine is a agent that strengthens the immunity against virus. Who is an adolescent? An adolescent is a child of 9 to 14 years. While choice is a freedom to decide willingly without fear. My point goes thus. First, parental and personal consent. Parents has the right to choose for their children what benefits their health. Forcing HPV vaccination on them has violated their rights. Allowing choice ensures that parents seek advice from doctors to know whether their decision is confident enough. Because each children are different. Parents understand their children's medical history, allergies, and sensitivities better than anyone else. Choice ensures that they are fully well and known of what they are dealing with. Also, even though it has been proven that HPV vaccination is safe and effective, still, it is not entirely true due to side effects. Adolescents suffer pains in injection sites, dizziness, fainting, nausea, etc. While in rare cases, severe reaction occurs to especially adolescents with special conditions. When HPV vaccination is made compulsory, it leads to individual differences. While choice ensures that the parents and the adolescents discuss about their potential difference to the medical care provider, in which they could provide solution on how they could discuss of a way to vaccinate such child without complications. Moreover, cultural and religious beliefs should be considered due to the fact that Nigeria is a nation where there are different cultures, religion, and all sorts. Their program. For example, in the northern part of Nigeria, the families are cautious of allowing injections and medical care for their children and women due to spiritual protection, prayer, or traditional cure before accepting medical care. Forcing vaccination on people like that could cause distrust and could even lead to violence. Choice makes them to embrace vaccination in their own terms and not with fear. Education is more effective than compulsion. Education makes the parent to be informed, the adolescent also to be informed. Education. Cervical cancer is a very major concern in Nigeria with 12,000 cases and 8,000 deaths per year, meaning 20 diagnoses and 30 deaths per year. These
Mr.
numbers
Finance and Panel of Judges, accurate timekeeper,
are
co-debaters,
really
ladies and
alarming,
gentlemen.
and
I
it
stand
has
before
been
you today to strongly support the motion that
so
HPV
these
vaccination
numbers
for
are really
adolescents
alarming, leading to a lot
should
of
be
things.
strongly released.
So, choice
Should be
ensures that
restricted as
the
related
parents
to
and
ordinarily assessed.
adolescents are informed of the implications, the complications, and also the ways in which HPV vaccination helps to cure them. Choice helps them to bring them together to also be reliant on people, on the medical care providers. In conclusion, making HPV vaccination compulsory does not help matters at all. In fact, it's not the best solution because choice makes them to respect their right and also makes people to develop interest in HPV vaccination. They are likely to accept it for respectively. Let's empower families so that they could give in to vaccination willingly without being forced into it. Thank you.
Thank you so much for that, Jolagemi. You also finished right on time. You had 1 minute and 30 seconds remaining, and that's quite incredible. I'm really amazed how young people can, speak so fluently, eloquently, and still, keep within a time limit. That's very, very impressive. And I can see how much work your supervising teachers have done, and I find that very, very impressive. So thank you so much for that amazing presentation as well. So that was Deborah Jolayemi. Can we all give her virtual, claps? Let's celebrate her, please. That was amazing. It's not easy to speak in public, it's not easy. Thank you so much. Thank you so much. So we're going to be moving right to the third speaker and the final participant for the team A, which is the supporting side. And the speaker for supporting side, the third speaker is going to be Afsat Mohammed Bello. Afsat Mohammed Bello, can you hear me? Afsat, okay. Can you speak a little bit louder?
Yes, ma'am.
All right. Okay, nice to have you here. So I'm going to start the stopwatch for you as well. And when I say start, you're free to start. So start.
Good afternoon, Madam Chair, esteemed judges, and my road debaters. I am Hafsat Mohammed Bello by name. Hafsat Mohammed Bello from Ilimi International College, Gombe State. I would like to introduce the topic HPV vaccination for adolescents, a necessity or a choice. I stand here to support the motion which the HPV vaccination should remain a choice, not a necessity. According to Oxford Learner's Dictionary, a choice is a noun. It's defined as the act of choosing between two or more possibilities, power, and opportunity to choose, or the range of things available to choose from. Parents and individuals should be given the opportunity to make medical decisions for their children and themselves. This because there should be respect for parents' rights and autonomy. Parents have the legal and moral right for their children because every child is different. For example, in 2024, there are some records of girls who took the vaccine having strong things like shortness on their lips, arms, dizziness, and also a migraine headache, and also a fever too. In northern parts of the country, we all practice different religions. A parent can reserve the right to protect their children from the vaccine. Making HPV vaccination a necessity removes freedom of choice, which is a basic human right. Secondly, education works better than coercion. People tend to accept things they fully understand. So instead of making mandatory, government should educate parents using campaigns, social media, door-to-door sensitization, as this will help people understand the benefits of HPV vaccination. Thirdly, forcing HPV vaccination for adolescents might create fear and distrust. Nigeria introduced HPV vaccination into its national immunization programs for girls aged of 9 to 14. In Nigeria, many people are already frightened about the vaccine due to some past misinformation, rumors on social media about the dangers of taking the vaccine. And people also die after taking the vaccine, which were unrelated to the vaccine. That creates a phobia among people. Government should encourage it, make it accessible, and does not make it a necessity. In conclusion, HPV vaccination is important, but importance does not justify force. A healthy environment is built with education, trust, and consent. When people choose to vaccinate because they understand its value, the protection is strong and suitable. Therefore, HPV vaccination should remain a choice, not a compulsion. Thank you.
Wow, thank you so much for that, Afsat Mohammed. You also were on that time. You have 3 minutes remaining, and that's impressive as well. So let us all share our virtual claps for Afsat. She did an amazing job. She was very eloquent. Not to speak, like I always mention. So let's give more virtual claps. Okay. Okay. Thank you so much. So we are halfway into the presentations. We have done with all the supporting speakers. Should we give a 1 minute, 2 minutes break for anyone else aside the participants to say 1 or 2 words regarding the presentations? So if you'll be willing to speak, just 1 or 2 sentences, just to give a little break, please, you're free to unmute your mic. Thank you. Okay. Adebayo Oluwatobi, do you want to speak? I see your hand is up.
Good afternoon.
No, for now, good afternoon. I'm not saying anything. They've actually been speaking well, and they've done well. They are doing well, actually. And I've learned a lot of things so far. Thank you for reminding me of some topics again. Thank you so much.
Thank you so much. Thank you. Really appreciate that. That's the purpose of having debates. It's an intellectual discussion, to make us think and reflect on practices that we have forgotten about. So does anyone else have anything to say before we continue? Please unmute. You're free to speak.
Good afternoon, ma'am.
Good afternoon.
Ma'am, what I'd like to say is
we can hear you.
I entered for the competition, but my name was not called earlier. So I'd like to.
Okay, all right. Okay, so just to quickly clarify that, we had like a lot of respondents. We had a lot of people that applied, but we had a team of people that actually reviewed our applications, and out of the applications, only 6 qualified. And these are the 6 that are currently debating. So we appreciate your effort in applying. Like, you're amazing. I'm sure you do know that. So next event, next debate, I want you to also apply again. And I'm certain that I'll be seeing your face very soon. So thank you so much for that brief question. I love that. You're amazing.
Yeah,
Thank you.
I just wanted to clarify that you qualified, but we can't accept everybody because we have limited number of time. So everybody qualified, everybody.
Wọ́n sọ wípé àwọn mẹ́fà ti qualify pé àwọn sì mọ debate.
No, that's not it. You qualified, everybody qualified, but we have limited number of slots. So that's why we chose who were ranked higher. But meanwhile, please be on the lookout for more announcements. We'll make, yeah, be on the lookout for more announcements. We'll make more announcements for more debates, because it's gonna be a continuous thing, because this is this turnout, it's incredible. I didn't expect this number of people to be here, but so we are actually moved to continue this on maybe monthly basis or quarterly basis. So you may continue to apply each time we call for applications, and then hopefully subsequent applications you will be selected. But don't give up yet, okay? You are qualified, but we have limited space for today. Thank you.
All right, thank you so much for that. Just to chip in, please, if you're not speaking at the moment, please let us try to unmute, not unmute our mics, because it's going to contradict what another person is saying. So if you want to speak, you can simply raise up your hands. I will call on you, and then you are free to share your thoughts. So I saw a comment now from Karaizana. I noticed that you were trying to speak while another speaker was speaking. So like the president mentioned, we had a huge turnout of applicants, and why a lot of qualified, we only could pick 6. And so in subsequent events, debates, we'll be looking forward to application, and then you'll be free to speak. I know you're very excited to speak. I saw that when you were talking. So I'm really looking forward to hearing you speak and debate very soon. So thank you for understanding, Kayari. Thank you. So thank you so much, everyone, for your inputs. It's lovely seeing your faces. I like the fact that a lot of us have videos turned on. I think that adds the beauty of this event. So thank you all for that. So let's move to the opposing side with Team B. Team A have done exceedingly well. Very impressed by all Team A had to say. And why this is a debate competition, it's actually a platform to learn, to discuss, and to share ideas. So let's not forget that. So for Team B, they are opposing the title, which is they are saying that HPV vaccine is a critical public health necessity and should be prioritized and mandated to eliminate cervical cancer in Nigeria. So for Team B, we have also 3 participants. We have Justina Bolatito Akimbade, we have Samal Abdul Wahab, and we have Sadatu Usman. So in that order we presented. So we're going to have Justina first, then Salma, and then Sadatu. So let's go into it. So Justina Bolatito Akimbade, I can see you're ready. I saw your teacher zooming in, zooming out. You're very ready. I love that. So I hope you can all see her, because I can see her. She's standing by the whiteboard. She's ready. So I'm going to be setting the 7 minutes timer for you as well.
I just wanted to remind her microphone is muted.
Are you ready? Let me.
Her microphone is muted, so she has to unmute. All right. Thank you.
You can hear you too. Can you speak?
Good morning.
Good
afternoon.
Okay, good. Okay, good afternoon. Good afternoon. Morning to works. So I'm going to start the stopwatch now. So when I say start, then you have to start. Good luck. Start.
If a child is standing by a rule and then is putting towards them, do we stop whether being a way should be optional? Or do we act because the evidence is at risk? This question belongs to the
Good day, distinguished judges, respected panelists, my fellow debaters, and everyone joining us. My name is Akinbade Justina Balasto, speaking to you from Unique Minds International College of Ilesha Road, Osun State, Ile. Cervical cancer is a real and present danger in Nigeria, and HPV vaccine is a proven method of protection. This issue before us is about treating a deadly but preventable disease as a matter of choice or as a necessity. No, not as a matter of choice, but as a necessity, with this point of mind. Firstly, according to data referenced by the Federal Ministry of Health and supported by the World Health Organization, about 12,000 Nigerian women are diagnosed with cervical cancer every year, and over 8,000 die from it. This makes cervical cancer one of the leading causes of cancer-related deaths among women in the country. This also proves that the problem is not marginal. It affects families, it reduces workforce participation, and places a heavy burden on the healthcare system. When a disease is known to consistently cause such harm, it demands for collective action. Secondly, the medical causes of cervical cancer has been clearly established, which strengthens the case for prevention. Persistent infection with high strain risks of the human papilloma virus is responsible for nearly all cases of cervical cancer. This is not a speculation or a theory. It is settled medical evidence. The HPV vaccine targets the most dangerous strain of the virus. When administered to girls aged 9 years to 14 years, it is highly effective. This treats cervical cancer for being a tragic inevitability to a preventable condition. Thirdly, Nigeria's health policy reflects this medical reality. In 2023, the federal government of Nigeria introduced the HPV vaccination to the National Routine Immunization Schedule. Vaccines based on this schedule are not treated just as an optional lifestyle choice. They are prioritized because they protect population health and they reduce the long-term disease burden on the healthcare system. The Ministry of Health decision aligns with the demonstrations and recommendations made by the World Health Organization aimed at eliminating cervical cancer in the country. This policy move alone shows that the government recognized the HPV vaccine as a public health necessity, not just as a matter of choice. In addition, leaving HPV vaccine as a matter of choice weakens protection and increases inequality. Choice assumes that parents have adequate access to accurate information, proper healthcare facilities, and medical guidance. But in reality, misconception, misinformation, fear of vaccine, and poor healthcare system are major barriers towards receival of these vaccines. As a result, girls who are most likely at risk are often not a chance to receive these vaccines. Treating it as a necessity corrects this imbalance and makes sure that receival of these vaccines is not based on level of information or level of income. Moreover, public health interventions succeed when collective and not fragmented. Nigeria's experience with polio demonstrates this clearly. Polio was not eliminated through voluntary uneven uptake alone. Polio was eliminated through nationwide prioritization, policy commitment, and consistent delivery. This same logic applies to the elimination of the cervical cancer. High coverage of this HPV vaccine leads to health protection, reduced transmissions, and finally the elimination of cervical cancer in the country as a public health threat. But low coverage of these vaccines causes this disease to persist. Furthermore, treating the HPV vaccination as a necessity provides a strong and practical solution. It allows the vaccine to be systematically delivered through schools, primary health care centers, and adolescent health programs. It also ensures consistent delivery and normalizes the HPV vaccination as part of standard healthcare. This approach does not remove parental involvement, but supports it through education access, trust building, and ensured informed consent through a structured system. In conclusion, returning to the question I first began with, When a disease is known and prevention is available, inaction becomes a decision with consequences. Cervical cancer continues to kill thousands of Nigerian women every year, not because prevention is impossible, but because protection is uneven. The HPV vaccine, supported by medical evidences, national policies, and global best practices, should not be treated merely as a preference, but as a necessity. Thank you.
Wow, that was amazing, Elizabeth. I see you already have our virtual claps. Thank you so much for the virtual claps. We finally have the first person that spent 6 minutes. So that's interesting. So thank you so much for a lot of claps. Thank you so much for the claps, the activity, the interaction. Thank you all so much for being part of this debate competition. So Olatito Akimbade, the first participant from the opposing side. So thank you so much for that amazing presentation. So okay, I can see people are still, thank you. People are still clapping. I want you guys to finish clapping. I want to give you guys the time to clap as much as you want. Okay, let's have some seconds for just clapping. Oh, thank you so much. Oh, lovely hands, beautiful hands. Wow. Thank you so much. I love the energy. I love the interaction. Oh, wow, beautiful. I can see love. Oh, participants, catch your love now. Wait, while you can, catch it now. All right, thank you all so much for the interaction. We love that. Thank you so much for appreciating our debaters. So moving to the second participant for the team B, we have Salma Abdul Wahab. Salma Abdul Wahab, are you in the building? If you are, please. Okay. Where are you, Salma? Looking for your video. Salma Abdul Wahab. Oh, are you the one? Why? Can't find. Can you speak? Salma. It's Salma Abdul Wahab here. I think I heard her speak. Okay. Sam, are you using Infinix? Are you the one using Infinix X650-1B? Just unmute yourself and speak. Okay, Salma, can you speak? Hello, Salma. Can anyone else hear Salma? Maybe it's a network glitch on my end.
I think the teacher said he'll be joining in a jiffy. Do we have another speaker? Or is it the last speaker for today?
Maybe because the last speaker has been reaching out to me. She's been having a very terrible network coverage, like zero network. So I've been trying to converse with her and a speaker and a teacher rather, but they wanted me to place her last, and I don't think that is. So I mean,
all right. Maybe we'll give a little time. If they don't join, we may have to select two people from the call. That is how opportunities come. We may have to select 2 people from the call to do it on the spot. That will be really interesting when you see. Yeah. So let's give a little bit of time just to allow them to log in. Maybe a minute or so or 2. Then if they are not on board, then we can transition to the plan B.
Okay, so I think we should have a short break now. In that time, I would love to, I know we have some teachers here. So if you don't mind, maybe teachers, parents, members of ONSN, we would also love to hear you say a few words to us. So if you have something to say about the debate, the topic itself, or even the participants, we welcome that. So this is the time to speak. You can unmute your mic and speak. Thank you.
Well, I just wanted to acknowledge the presence of some of our board members. I know they've mentioned Mr. Mustafa Aliyu. He's one of our strong board members on board. Mrs. Olamide Balogun. We have Roslyn Ogunkunle. Yeah, calling right from the beautiful city of Houston. We have our moderator is also our board member. So I just wanted to use this opportunity to thank them for joining us today. And also, I think I see Mrs. Martins Akinlose. Yeah, she's also part of our board members. She's on the call. Yeah. Moderator, you're muted.
Oh, that was not a network glitch. It was me. Okay, so I was just saying that board members are amazing people, and it's always glad to see a lot of us gathered there. And I'm so glad that we were able to make time to be here today. So
before I commit a blunder, I think Dr. Deliverance Brotobo is also on the call.
Oh,
so I
wow.
wanted to acknowledge her too. And a couple of others from different parts of the world. I see people calling from the beautiful state of Michigan in the United States. I see people calling from different parts. Yeah, so I just wanted to appreciate everybody for attending our first episode of this debate. I see the Aquanos. Kudos to you, every other person who is on the call. Thank you.
All right. Thank you so much for that. I also extend my, my appreciation for everyone being here. It's not easy to come here at this time of the day, but I'm glad you're doing to support these beautiful, amazing students because they are quite amazing. So, in the meantime, I don't want to confirm if Salma, are you here now? Can you speak? I don't want to confirm your presence again.
Yes, I can.
Yes. Okay. So that's some Chastain Alex. We thought we lost you. We're glad you're back. So welcome, Salma, from Chastain Intellect International. Okay, so Sam, are you ready?
Yes, I am.
You thought about it first, but it's fine. All right, I believe you're ready, and I trust in you. All right, so I'm going to start the stopwatch, and when I say start, then you're free to start speaking. Is that fine? All right, so start.
Okay. Good afternoon, judge, teammates, and opponents. My name is from Intellect International School, Ilorin, Kwara State. The topic for today's debate is for the motion that this vaccine. The definition for today's debate is as goes. Virus that can be contacted through skin unconscious cancers. Vaccine is any substance that is taken to boost immunity or prevent a disease or virus. Adolescents are. The resolution for today's debate is that the human papillomavirus vaccine should be administered compulsorily for all citizens of Nigeria. I will begin by stating my points and tell you, Judge, why I support the resolution that the human papillomavirus vaccine should be administered compulsorily. Firstly, personal choice and freedom ends where cervical cancer begins. The main point here is that personal freedom has limits when one's personal opinion affects more than that person alone. Individual consequences is not what is at stake when one makes the wrong opinion. One person's personal opinion can affect the general public, and the community and society and our country in general need to work together to boost the human papillomavirus vaccine administration. HPV is a disease that is spread unconsciously during sexual intercourse. So when an unvaccinated patient spreads this disease to future partners, it is already too late to get vaccinated at that point, and the virus has already spread, which has limits when it comes to cervical cancer. For the national HPV program that began in Japan in December 2010, it was later suspended in the year 2013 due to several rumors. It was also said in this study that Japan lost the opportunity to face cervical cancer head-on, the way countries such as the United Kingdom and Australia were able to due to this suspension. It was also seen that from the year 2013 to the year 2019, cervical cancer deaths were about 5,000 deaths due to this suspension. This comes to show the importance and how imperative it is to administer cervical cancer vaccines for our citizens. If 5,000 deaths, morbidities, and mortalities could have been prevented, surely wrong opinions on unwise and researched freedom is not what is important at this point. Secondly, making it optional increases inequality. Making the human papillomavirus vaccine optional increases inequality greatly. This is due to the fact that when the vaccine relies on out-of-pocket money, one could decide to choose this vaccine based on socioeconomic status, race, ethnicity, or even location of an individual. Healthcare facilities and access to these healthcare facilities should not be based on where a person is living. A person living in a rural area and a person living in an urban area should have the same opportunities and access to healthcare facilities because one's health should not be based off where they're living. In a study that was done here in Anambra State, Nigeria, it was seen that this study was conducted from 137 healthcare workers in Nigeria. These healthcare workers were mostly female, having Christian religious beliefs, and were living in rural areas. It was also seen that what caused the greatest margins were lack of awareness, costs, and lack of availability of this vaccine. Once this cost is high and people have a lack of awareness, it shows that this vaccine is administered to these cities. Where a person is living should not be what determines whether they live a happy and healthy life. What should determine this is that everybody needs to be administered the same vaccine because everybody has a right to health and freedom. Thirdly, making the human papilloma vaccine is a necessity, is imperative because when it is administered, some people use the excuse that the risk of vaccine is great, but the risk of the vaccine is actually tiny compared to the risk of cancer. That cervical cancer causes diseases such as clear cell adenocarcinoma, adenocarcinomas, and squamous cell carcinoma. Deadly and lethal diseases. They say prevention is better than cure. And Gardasil 9, a vaccine for HPV, has been tested several times, and it has come to show that the side effects surely do not balance or outweigh the side effects of cancer. Cancer is a widespreading disease in our country, in our nation, and it needs to be prevented and stopped as quickly as possible. 12,000 women are diagnosed with HPV annually, and these 12,000 women could have been prevented if the HPV vaccine was administered compulsorily and as a necessity. While some might say that acquiring this disease is due to a lack of rational thinking and not normal day-to-day activities, while they may be right, this is wrong for some, because administering this vaccine does not give them a sense of security in a wrong way. It gives them a sense of security in the way that balancing it out with enlightenment and this vaccine gives them a sense of security where they know that no matter how they react in the future or no matter how they behave, they know that they have already been administered this vaccine and they have a rational thinking that prevents them from irrational behavior. While some parents might say that this vaccine is not needed because their children are not yet sexually active, prevention is better than cure. So it is better to prevent this disease rather than waiting for the disease to reach the patient and then trying to cure it, because many people do not get cured. While not administering the vaccine may not make it sure that one is going to receive the disease, prevention is better than cure. Judge, for these reasons are why I state and support the motion that the human papillomavirus vaccine should be administered as a necessity and not a choice. Thank you.
Thank you so much for that. That was powerful. I believe gonna agree. Please, I can see the love, the emojis, the virtual claps. Thank you all for just immediately responding to her powerful speech, and you did so well. You were close to the clock, but you had about 17 seconds to spare, so you finished on that time. So well done for that. So thank you for that wonderful presentation. Please, if you have more claps for her, more love for her, please share. Don't be stingy. So thank you everyone for your great participation, and thank you so much for that presentation. So we're slowly moving to the we're already at the final presentation of the day. We're slowly moving to the end of this beautiful debate. It's been such a great time, and the final person to present today is going to be Sadat Usman. Sadat Usman, are you here? If you're here, can you show us your video and also your speak to us? Let's confirm that you're here. Sadat, so are you here?
Good day, ladies and gentlemen, panels of judges, accurate timekeeper, co-debaters, and my fellow students.
Please hold on. You're not that now. Just a minute. I just want to confirm that you are here. Okay, you are here, right? Can you show your video? Sadatu. Hello.
Good day, ladies and gentlemen, panels of judges, accurate timekeeper, co-debaters, and my fellow students. I am Oyelade Blessing from
Hello, Sadatu. Okay, so hello, Sadatu. Can you hear me?
I think this is a different person. Not
yes, because
not Sadatu.
She was here. I saw her here like a few. Sadatu Usman is here. She's here. She's unmuted. Can she hear me? I don't know if she can hear me.
I think she should unmute.
But I can see her name on. Yes, Sadatu, can you unmute yourself? Sadatu.
Good day, ladies and panels of judges, accurate timekeeper, co-debaters.
Please kindly hold. I'm trying to connect with her. Okay, so I think I'll just take 5 minutes to reach back to her and Atisha, and I'll be right back.
So while we are waiting for Sadat to join, I know we have a lot of people who are so zealous to present today. So just on a personal note, we'll be extending it to one additional person for the person will be getting 20,000. That's a different arrangement entirely. So I would extend it to one person. So if you are sure you are ready, you have network, just send your name. I'm gonna select it randomly, and that's the only one we are selecting randomly. Okay. You don't have to. Everybody does not have to present today. There are other opportunities ahead of us. So just send your name on the chart, And then I will select it randomly. Whoever is selected will be allowed to, I will tell you whether to support or to oppose the debate. The essence is, why you are receiving the 20,000 is because I'm the one determining what you are presenting. So for you to present it on the spot, it's, a great talent. So yeah, continue typing your name. If you are ready, you have good network, then we'll take it from there. Thank you.
All right. Great opportunity. Opportunity comes to those who take it. So thank you so much to our esteemed president for that amazing opportunity. I wish I were a student too. I would have filled in my name, but I'm not being an agbaya. So why we do that, why we drop in our names. Sadatu, I reached out to her now. She said she had a network glitch and she's trying to join back. So Sadatu, can you speak now? Is your network better? I know she's here, but Sadatu, can you speak?
Yes, ma. When I think I want to say, hello, ma, can you hear
Yeah,
me?
I can hear you.
Yeah, we can hear you.
Yes, I can.
The HPV vaccine. Can I start?
No, can you switch on your video? Is that possible?
My video.
Yeah, switch on your video so we can see your face.
Okay.
Hello, Sadatu, are you still here?
Yeah, I can see her.
Okay. Sadatu, can you speak? Sadatu, are you here with us? Hello?
Can you see me now? Can I start?
Okay, let me start the stopwatch. So yes, you can start. Hello, Sadatu, are you here? I think she's left his Zoom. I think the network is really affecting her. So I think we should go into the selecting those that would have an opportunity to present, and when she's more stable, she will have opportunity to make a presentation. How does that sound?
That sounds good. So that we don't waste time. I think she's back.
So that's right here. Okay, so that's so. Can you speak? Can you unmute yourself so we can hear you?
All right. So let's just take my own participant. And just for the sake of fairness, I'm gonna select a man. So there are men that are on the call, so I ran them through their names on ChatGPT to random, just give me a name, and the name that popped up was Samuel at the bottom. So we'll give Samuel at the bottom the opportunity to oppose the motion, that is supporting the fact that HPV vaccine should be a necessity and not a choice. So Samuel at the bottom, this is your time to shine.
Thank you very much for that.
So 7 minutes too.
Thank you so much for that opportunity. Good day, Mr. Chairman, panel of judges, the accurate timekeeper, my co-debaters, and ladies. And I stand to support the motion that says HPV vaccination is a necessity. So, through the years, the HPV virus has been attacking so many people, and this is more prominent in adolescents. Now, what is HPV? HPV is the human papilloma virus, and it is known to attack the body system. And over time, if care is not taken, there have been so many deaths recorded due to the human papilloma virus, and it also causes some cancers like cervical cancer, throat cancer, and some other cancers. So the human papilloma virus vaccination is a critical and life-saving preventive measure that protects against high-risk strains responsible for nearly all cervical cancers. So according to the World Health Organization, the cervical cancer is sorry virtually all the cervical cancer cases, about 99% of them, they are linked to genital infection, in which human papilloma virus, as I've said earlier, is one of them. Why is human papilloma virus vaccination a necessity and not a choice? Firstly, the human papilloma virus vaccination prevents over 90% of HPV-related cancers, particularly when administered before exposure to the virus. Now, the human papilloma virus over the years has caused about 8,000 deaths annually, as far as Nigeria is concerned, and it is, as I've said earlier, prominent in adolescents. Secondly, human papilloma vaccination is necessary because it provides protection for all genders. While it is crucial for preventing cervical cancer, the vaccine is both for male and females, protecting against genital warts, penile, anal, and head, neck, and neck cancers for the cancers that I have said that human papilloma virus contributes to. So, thirdly, human papilloma virus vaccination provides high efficiency at younger age. That is why, as I have said earlier, the cervical cancer is more dominant in adolescents, and this vaccination is administered to adolescents between the ages of 9 to 14. Now, the immune system produces a superior response in preteens like from ages 11 to 12, offering the strongest protection. Thirdly, human papilloma virus prevents infection spread. It is a highly common sexual transmitted infection. Vaccination before sexual activity is key to stopping the spread of high-risk strains. While some parents say that the uh, human papilloma virus vaccination is a choice, as some of my co-debaters have said earlier, it is also important to know that while adolescents are not yet sexually active, it is very important because there is a common saying that says prevention is better than cure. And once a human papilloma virus leads to cancer, we might not be, the human immune system starts to react to so many diseases which can lead to death. Now, fourthly, long-term security. The vaccine offers a lasting protection against multiple dangerous human papilloma virus types. According to the World Health Organization, the human papilloma virus vaccination is, the human papilloma virus itself does not take, does not lead to death uh, because when the human papilloma virus is in the body system, it does not show symptoms, which is one of why it is very deadly. Because, as I've said earlier, human papilloma virus poses the risk of people having various cancers, in which cervical cancer is the most important one. And as I have also said earlier, the cervical cancer can lead to so many diseases which can take the life of people. So earlier on, some of my co-debaters have also said that the human papilloma virus vaccination is a choice because of cultural values and parental values too. But I would say that prevention is better than cure. And I would say that the public health sector of Nigeria relies on both awareness and action. What do I mean by awareness and action? The public health sector of Nigeria spread this human papillomavirus vaccination to reduce mortality rates. And what do I mean by mortality rates? Mortality rates are death rates. The rate of death is about 8,000 annually area. So now, as I've said, public health sector relies on awareness and action. They help to spread the awareness of this virus, because some of my co-debaters have said earlier that the education is more better than imposing this vaccination on students. But I want to say that education informs the mind and vaccination protects the body. Vaccination provides antibodies into the body system, into the bloodstream, making it possible for the bloodstream to resist the human papillomavirus. And once it resists it earlier, it reduces the risk of ever having human papillomavirus. So in conclusion, like all of the vaccines, the human papillomavirus vaccination causes mild short-term reactions and side effects, because we bother about that a lot. But serious, these side effects, they are minor and lesser than the risk that cervical cancer poses as a result of the human papillomavirus. So it is necessary to know the importance of the human papillomavirus vaccination and protect the well-being of all of our adolescents, and also, most importantly, reducing mortality rates. Thank you.
Well done. Amazing. Narrow escape. You almost exceeded your time, but that was beautiful. I love that. And it's quite very, very impressive that you did that. And you were not even prepared. Like, you didn't even have like the time. You didn't have, the supervision that maybe other debaters had, and you were still so eloquent. Samuel, you're amazing. And I love what you did. You educated us, you enlightened us, and you showed us that, okay, yes, we have a future male nurse among us. So thank you for that. That's amazing. Please let us give our virtual claps to Samuel.
Thank
That
you
was
so
great.
much, Samuel. You are not part of the contestants, okay? But then you were called on the spot, because I see you're not wearing your uniform, so you were not prepared for this presentation. So you were called on the spot. So that is so exciting. That's so intriguing. So automatically, you have earned yourself a 20,000 this afternoon. So just send me an email on info@onsnigeria.org. Send an email at info@onsnigeria.org. Mention your name, that you were the additional debater. I will understand, and we'll take it up from there. Okay? Thank you so much. Yeah.
Congratulations, Samuel. See, opportunities actually do come, and when they come, it's up to us to grab it, as well as God to favor us that our names will be chosen. So thank you for that. Kudos to our president. We love that. This is why we at Corner Society of Nigeria, this is why we do what we do, to empower people, to empower the younger generation, to make a change. And I know that Sam, when you go to school on Monday, you're going to tell your classmates, oh, I was at ONS debates, I won 20,000, I wasn't even prepared, but I did so good. And you're going to educate them about cervical cancer, your female colleagues or female, your classmates. Tell them about the vaccine. Inform. You can also talk to your teacher, because I see you're a very smart person. It doesn't just end there. It ends also with us going back to our families, our schools, our communities, and also educating them with what we have learned today. Because it's not just a debate, like I mentioned earlier. This is an avenue to learn, to discuss, to share ideas, all for the sake of reducing cervical cancer in Nigeria, all the sake of promoting HPV vaccine in Nigeria and saving future lives. So thank you, Samuel, for that. That was very, very inspiring. We really appreciate you. Thank you so much. Okay, so Sadatu Usman, are you back here with us? Are you?
I would like to say something that sorry, can I please say something?
Yes, you can.
I just thank the host and thank the whole Oncology Society of Nigeria. Thank you. It means so much to me, and I appreciate the opportunity. Thanks so much. I'll do well to register for the next competition and prepare well. Thank you very much for this opportunity. I really appreciate it and do not take it for granted. Thank you once again.
Thank you, Samuel. You're such a cutie. Thank you. Thank you. Amazing. You're honestly so amazing. Thank you. So that's Usman. Back to you. Are you here? I hope she's here. So that's Usman. Hello? I don't know if she's even in. Is she here? I don't think she's here. I think she's unfortunately being held back by network, but I'm going to reach out to Atisha and her again via call, just to check on them and see what's going on. So in that regard, we're going to be having another break, just a mini discussion. I've been seeing Dr. Rosaline. She's been smiling. She's been with us, and I want to hear her voice because she's been smiling. She's been interacting with her eyes, with her face. She's beautiful, she's board member, she's director of Diaspora Affairs, and really want to hear from her because she's very amazing as well. So, Dr. Rosaline, you have the stage.
As soon as I can find my unmute button. Good morning, everyone. This has been such a pleasure to listen to all of the young minds. Oh my goodness, I am so blown away. And trust me, I have learned from you. I enjoy hearing the evidence, the enthusiasm in your voice. You have all done your research, and I wish you well. We hope that this engagement will continue and you will go back and bring your friends and colleagues to participate in the future ones. Thank you for spending your day on this very important course. There's a lot of work to be done. Prevention is one good way. I'm not going to say too much because this is a debate. So thank you for being here. And I'm very honored to be part of this as well.
Yeah, I think Sadatu Usman is here now. I can see her video is a bit more stable.
Okay. I almost had the network glitch there. So I'm back. Okay, Sadatu, are you here? Sadatu, can you speak so we confirm
Yes,
that
ma'am.
you're all right? Perfect. I'm so happy to see you. Trust me, I'm the happiest. I'm so happy that you're able to fight against all barriers. So thanks so much for being here. So without wasting time, because we have limited network stability, once I say start, you can start presenting, okay?
Yes, ma'am.
All right, so start.
The HPV vaccine is safe, effective, and protects against cervical cancer. A cheerful, wonderful good day to you all, Mr. Chairman, Mr. Speaker, adjudicator, co-debater, distinguished ladies and gentlemen. I have my name started to Usman, a student from Destiny King Kankwi Model College, Nasarawa State. Before us is the topic, HPV vaccine for adolescents, a necessity to a choice. I am here to propose the motion, but before I proceed, I would like to define the key term HPV, human papillomavirus, adolescent necessity and choice. According to Wikipedia, HPV, human papillomavirus, is a common virus that can lead to cancer like cervical, anal, throat, and genital warts. It is transmitted through skin-to-skin contact, often during sex. Adolescent is a stage between being a child and an adult. Necessity is something which makes an act unavoidable or something request. Choice is an option or decision to choose or select something. How to prevent HPV, human papillomavirus? Get vaccinated. HPV vaccine. Do not smoke. Practice safe sex. Use of condom, limited partner. The diagnosis of HPV. DNA test. DNA test. Below are my points. Never experience unprecedented cancer prevention. According to Gadazina, HPV vaccine HPV vaccine is not 100% effective in preventing high rate of HPV, about 90% of cervical cancer, as well as vaginal, anal, or oral cancer, but better than not taking it at all, because it prevents 70% of adolescents from cervical cancer. Furthermore, immunizing the young adults at this age creates herd immunity, protecting those who are unable to get vaccinated before the exposure of the virus. Furthermore, optimum timing age for the vaccine to be most effective, according to National Institute of Medicine, NIM, it must be given before the exposure of the virus, e.g., before sexual activities, marriage, until the adulthood to reduce the spread of the virus. In addition, social justice and equity. Mandatory programs in school ensure the regardless of status or parental education level to receive the protection of the health, narrowing to the health issue. Nigeria's campaign succeed. 17 million of girls vaccinated since 2023, target in 2024. Since in 2023, targets 40 million by 2025. Adolescent focus. Vaccinating before the exposure of the virus debut ensure protection. World Health Organization issue. WHO good. 90% of cancer coverage by 2030 to its record. In Nigeria, cervical cancer is the third most common and second most common frequent cancer that causes death among women between age 15 and 44 years old. In 2020, Nigeria is the latest state which data is available. 12,000 new cases. Nigeria records 12,000 new cases and 8,000 deaths from cervical cancer. With this point of my own view, having spoken about HPV, having spoken about unprecedented cancer, HPV, having spoken about unprecedented cancer prevention, herd immunity, and border protection, social justice and equity, Nigeria's campaign succeed. Adolescent focus, World Health Organization issue. I hope you are convinced and not confused that a choice. I still remain Sade to Usman. Thank you. Public safety is a collective responsibility. Thank you.
Thank you so much, Sadatu. Thank you. Please let's send a lot of virtual claps and hugs. I'm really so proud of you, Sadatu, because I know how much you really wanted to do this. I know how much the network inhibited you. You had to go to your neighbor's place. Your teacher had to put in a lot. You had to really change your SIMs. Like, it's really, really not easy to have prepared for a debate and to have, and she has been on her phone since 1 p.m. She has been trying to log in since an hour before the event. So it's been a lot of, work for her, and I'm really so honored, and you are amazing. And I'm so glad you did it. I'm so proud of you. Like, you did your best. You are amazing.
So I want to come in here and say how much. I think, is this the last presentation?
Yes, she is.
All right. So I just wanted to share how proud I am of you guys. Regardless of the outcome of today's debate, I'm extremely proud of everybody who has actually participated in today's Sadat, I see you are crying. There's no defeat. Okay. There will always be multiple opportunities, and besides, I also want to announce, since just for participating in today's program, regardless of your position or wherever the outcome will be, everybody who participated in today's debate, the six of you, this is also not from the Oncology Nursing Society. This is a personal commitment. Everybody is getting 20,000 each, regardless of your position. So the Oncology Nursing Society will announce their own, they will announce their own awards. But then for participating alone, everybody gets 20,000. So regardless of wherever position you fall into, you are sure going home with something today. So that should settle your mind. Is that okay? All right. So I yield to the moderator to finalize today's program, and then we'll call it a day. Thank you.
Thank you so much. Like, I'm so happy. I'm so happy because I'm talking to these children, these kids, these students, and I know how much work they'll text me. Can I do this? Can I not do this? Like, they are super motivated to do this, and I'm so happy that you all were able to do this today, to speak. It's a great thing to actually share your idea. It's a great thing to stand from the camera and talk as bravely as you guys did. And regardless of the results, you all are so amazing. And I'm so glad to have met all of you. I'm so glad that you all were able to do this. And I just want to say that, like, Sadato's story to me is just so amazing because she was calling me back to back throughout this entire event, and she's so resilient. And I just want to say a special thank you to Sadato for being so resilient and for, doing your best to ensure that you present regardless of it all. Thank you so much. You're amazing. So to move back to the debate, it's a competition, and in the competition we have prizes from the society. And we have like 3 prizes for the first, second, and third position. Our judges will be sending me their score sheets, and I'll be taking a minute or two to compile them and then share the final result. But before then, I'd love to also appreciate every one of us again. Appreciate the audience and also the people that contributed to the prizes that the first, second, and third person to be getting. And one of our amazing donors, Mrs. Akinose Martins, donated part of the money for the prize to us. And she's a board member, and she's an amazing, amazing person. I don't know if she's here, but a huge thank you to her for being part of this, for choosing to support this beautiful students. Okay. Oh, wow! I'm so happy.
You're doing a great work. Thank you.
Thank you so much. Thank you so much. I was looking for her on the screen, and then she just popped up. So yeah, that was my surprise. So yes, thank you so much, Ma, for your donation. Thank you for being here. Thank you for supporting us. Thank you for supporting these amazing kids. Thank you so much. We also had another sponsorship. I think the president will know his name. I can't remember his name right now, but we have a sponsorship.
Dr. Rashid Oladapo. So
okay, from Dr. Rashid Oladapo. Thank you so much for that. So you also, gave his part of the share of the prize, and it was so amazing. We didn't expect it. We love when people come together to do this like this, because we can't do this alone without people supporting us, people rooting for us, people telling us that, oh, I'm going to do this to help you fulfill this dream, fulfill this vision. And it's really great to have people that really believe in us, really believe what we're doing, and really thank our donors for putting in their part to ensuring that these amazing students get prize money for doing this. So I'm going to be taking a 5 minutes break just to accumulate the scores and get back to us. In the meantime, I'm going to open the floor down to us to speak. I know we have members of the society here, and if you want to say, and this is the time to say anything that you want to share, more information, more ideas, more solution on how we can battle cervical cancer in Nigeria. If you have any opinions, any ideas, please share. We want to really learn from you because we have, esteemed nurses, esteemed clinicians there with more experience than us. So thank you so much. The floor is open.
Yeah, before they speak, I just wanted to also share an idea, an initiative that we will be taking shortly. So as the Oncology Nursing Society of Nigeria, our goal is actually to empower people, empower our members, and also empower people around us. And we have seen a great opportunity among secondary school students. So very soon we'll be calling for those who want to be our ambassadors within the secondary school settings. If you want to be an ambassador of the Oncology Nursing Society, we will call for the applications shortly so that you are the ones that will be sharing cancer-related information around your setting in your secondary schools. And that will be a great honor to work with you to disseminate cancer-related information to our students. We know breast cancer is also a major thing now, even occurring among adolescents, unfortunately, and a couple of other cancer-related situations. So you guys are free to become ambassadors in your schools to create awareness, to gather people around. During your health week, you can also present about cancer. This is where we want to really use your cooperation, especially all the debaters for today. By the time we are done, we'll reach out to you guys. We have your numbers. We'll reach out to you, and then no, we'll take it up from there. But if you are interested to become an ambassador in your secondary schools, please reach out to us through our official email, or when the official call is launched, you can always apply to become an ambassador in your schools. So I yield to other people to make their comment.
Okay, as we collect the scores, I don't want us all be looking like everybody's so anxious with the results. Like I can see the participant face, they're like, I want to know right now, but just be patient. We are working on collecting the results in a few minutes, going to be right. So in the meantime, to have like the audience to speak. I know we have this stage actively scoring, and the scoring book was reviewed at the beginning of the debate, and all participants have the document with the scoring book. The judges just come in for some minutes to talk about their experience with the participants, how it has been for them, and any party what they have to the participant. So starting with Mrs. Balogun, we'd love to hear from you.
Now, maybe before we go, the vice president is here. Maybe she wants to say a word or two. Mrs. Fatima Adam.
Good evening, everyone. It's really a wonderful presentation. I did not see this coming because it's our first time, and seeing the vibe, I'm so excited. Kudos to all the students that presented today. Kudos to ONS for organizing this, and kudos to all our let me say our volunteers that made this happen. And kudos to those that supported us financially. We are really grateful, and we look forward to more of these exciting events. Thank you very much.
Thank you, VP.
Okay. Good news. Our results are finally in. I'm so excited, and like I said, July, why are you holding your neck? Why are you? Calm down. You all are winners. Calm down. It's not, I understand it. I understand the anxiety. We all want to win. We all are putting in our best efforts, and I understand that. So, amazing. Thank you all again. So, Miss Olamide Balogun was one of the judges. I would love her to just come on board and say one or two sentences before we finally review the winners. You all are winners, but the top 3 winners. So, Miss Olamide, are you here with us? Miss Olamide Balogun. Hello?
I am here. Can you hear
Okay.
me?
Yes, I can hear you.
Okay. Good afternoon, good evening, good morning, everyone. And it's so good to be here. I just want to say that every participant in today's debate has done really well. I mean, it's mind-blowing to hear such oratory prowess in our presentation, our delivery, and also understanding of the subject matter is also something that stood out to me while listening to all of your presentations. And I just want to say that it can only get better from here. And I really want to encourage everyone, every participant. Like we know already, everyone is a winner. So whether you're first place, second place, third place, or whichever place, just know that you are a winner for showing up here today, for practicing your lines, your scripts, and coming to deliver exceptionally. You're amazing. And from all of us at Oncology Nursing Society of Nigeria, we celebrate you. Thank you so much once again. Have a great evening. Bye.
Thank you so much, Mrs. Balogun. I love seeing your smile always. Thank you so much. That was an amazing job. She was behind the scene, scoring you guys beautifully. I can confirm it. Appreciate you and you've taken the time to, support us and, really, show your excellence through the scoring process. So thank you very much. So we also have Mr. Mustafa. Are you here? So you can give us a few words about the experience with participants.
Hello, everyone.
Okay.
Yeah, it's really a great moment to listen to young minds. I'm actually impressed and flabbergasted by the presentation made by these young students, and it shows that our future is bright. We're going to have people that are actually going to take over from us, and the future is really, really bright. So I want to appreciate everyone for availing themselves to this very important, all-important event, the debate. And all of you have done well. To our sponsors, to our donors, and to everybody who find time to join us. We say thank you so much. And I believe the Amorabake Salake is ready to announce the results. So let's remain there and be calm and listen to whatever we're going to hear from that. All of us are winners. There are not losers here. Thank you so much.
Thank you so much for that, Mr. Mustafa. He was also one of the judges. He's amazing. He has a vast experience in cancer, and we are so pleased to have him here with us. It was amazing. So I would like to call on our president. He has been here throughout in his view on your ONS staff. And I just wanted to say a few words more for us as we finally collate the results. Thank you, sir.
Well, I've spoken a lot already, but as a teacher, I always have something to say. I just want to sincerely appreciate everybody. Dr. Esther Folabi, I was not expecting you to be here, but you surprised me. So you're amazing. We recognize you. other members of the Oncology Nursing Society, Dr. Grace Imoluamen. We have Dr. Adeniji Oluwabumi. You see, these big names I'm calling are here to support you. And I'm sure you guys will also aspire that one day you will be called doctor or professor, and that is how it starts. Okay, our purpose is not just for the money. Money is not the purpose of it, but it's just to motivate you guys to reach your full potentials in the future. So don't relent on this. Don't relent on this. I think some of you who are interested in pursuing career in oncology or cancer, please, this is an opportunity for you to actually, show up for yourself or for your community and continue to learn what you need to learn so that in the nearest future, you guys will really reach the potential that you have actually dreamt about yourself. I also recognize Khadija Musa, Cynthia Hebu, a whole lot of oncology nursing member, Ozo Ebele Chuku. We have all of them on board. So, yeah, it's an honor to have all of you. It's an honor to honor Geraldine. It's an honor to have you. And I see my VP always smiling. She is actually the backbone behind what we do at the Oncology Nursing Society. She puts me on my toes on daily basis. So we work as a team, but then we also communicate as a team. We don't, we listen to one another. We also learn from one another. Nobody owns it all. And that's the spirit we've displayed here. Even though there will be a winner, but everybody is a winner. Right? Everybody's a winner. Everybody will go home with something today. Everybody will, you remember today for good. I'm sure, not just because of the money, but the exposure that we have actually, the opportunity we have presented to you guys. And subsequently, this will continue to go on. Yeah, this is not just a one-time thing. It's something we'll be doing on a regular basis. So just to end, because I can continue to talk from now till tomorrow. Thank you so much, everyone. And all the teachers that have done their due diligence, all the teachers, the school administrators, especially those who are on board today, we sincerely appreciate you. We'll call for more applications very soon. Please be on the lookout and make sure you apply. Write your narratives very well because the judging was from the narratives that you presented originally. Don't do it haphazardly as if it's just something. Do it intentionally because everything is done by intention. All right. So when we call for applications subsequently, we want everybody to apply. When you apply, you'll be called, and then we'll continue doing this moving forward. Thank you so much. Now I yield to the moderator to announce our winners for today. Thank you.
Okay, I'm back. Thank you so much for that amazing presentation, sir. Can you all hear me? Hello?
We can hear you.
Okay, thank you. So the winners of today's presentation, I think it has been said, a lot of times that you all are winners. You all, 6 of you were amazing and you all deserve the win, to be honest. If we could give everyone like first position, we could have done that, but that's not possible. So I'll be starting with our surprise debater of the day, person that didn't prepare. You actually were scored. You were scored by one of the judges, and I'm glad to tell you that your score was over 100. You had a 85 over 100, and you didn't prepare for the debate. I think that's very impressive. I think that's something that you should take home, and you should really, really be proud of yourself. And I can only imagine how well it would be if you actually did prepare for the debate. So kudos for that. So we'll be going straight to the 4th, 5th, and 6th, and then we'll be going to the 3rd, 2nd, and 1st. So starting with the 6th position, the 6th position cumulative score, that's over 200. We had 100 from the first judge, 100 from the second judge. So cumulatively, the 6th person came out with a score of 141 over 200. Please, let's give virtual claps. 141 over 100. And that person, let's clap first. Okay, that person was the second participant that spoke, and that person was on team A. I'm giving a moment to confirm the person's name. I didn't score knowing names, so okay, the person was on team A, and that person is no other than Deborah Jolayemi Modupe. Congratulations. So moving on to the fifth position. The fifth position came out with a score of 151 over 200. And that person was participant number 1. And person's names are Anna McJo. Congratulations for the fifth position. Then for the fourth position, the score was very, very close to the fifth position. The fourth position came out with 152 points over 200, and that was participant number 5, and that was Salma Abdul Wahab. Is she here? Okay, let's clap. Salma Abdul Wahab, 152 over 200. Congratulations. And now we have to move to the first, second, and third positions. Who do we have left? I know the remaining people are probably very nervous. So just to go through it, I'm nervous myself. I don't know why. But just to go through it as briefly as possible because of time, I'll be calling out the third, second, and fourth win and the winner. Third, second, and the winner. For the third position, person came out with 157 over 200. 157 over 200. And that person was participant number 3. And the person's names are Afsat Mohammed Bello. Afsat. I see your mom came to hug you. Congratulations. Then for the second position, the second position came out with a cumulative score of 158, just 1 mark from the third position, 157. And the second position came out with 158, and is no other person than, should I call it, than participant number 6 with 158 over 200. And that was Sadat Usman. Please, let's clap. Thank you so much. And finally, we have like the final review of the winner of the first cervical cancer debate competition from Oncology Society of Nigeria. And for the final review, I know by now we should have guessed the person is, but still the person came out with a cumulative score of 172.5 over 200. 172.5 over 200. And that person is none other than participant number 4. And the person's names are Justina Bolatito Akimbade. Justina Bolatito Akimbade. Are you here?
Yes.
Okay, congratulations. Our winner for the first National Cervical Cancer Screening Debates was Justina Bolatito Akimbade.
Thank you. Thank you very much. Oh my goodness. Wow. Thank you so much. Thank you.
Congratulations. So I'll be calling on the Vice President to give us a closing remark and to,
Thank you so much.
yes, I think everybody did amazing well. You have no reason to
Exactly.
be sad. You have no reason to feel bad. You did your best and you were all amazing at what you presented. So thank you so much for being here. So over to you, VP.
Good evening once again, and congratulations to our today's winner. Well, my advice to us all is anytime you are having a presentation or a debate, whatever it is, just put in your best. Don't believe you are presenting for yourself. Don't believe you are presenting for your school or you are presenting because it's a society. Believe you are presenting for your country, because Oncology Nursing Society of Nigeria represents Nigerians. We are all Nigerians. It represents nurses. It is the society that is governed by the oncology nurses, the nurses managing patients. When it comes to patient care, we believe nurses are the backbone of healthcare. Believe you are representing your country, put in your best, and I wish all of us all the best. Good evening, everyone, and do have a wonderful evening. Bye.
Richard.
Oh, but when there's one.